The examination and treatment planning phase involves a great deal of care and attention being focused on the child's physical and emotional well-being. It's important to maintain conversation with your patient. Follow the tell, show, do method. Tell the patient what you are about to do. For example, I'm going to go over there to wash my hands now. Show the patient what you are about to do. For example, showing them the instruments that will be used and how they work. And do exactly what you have explained to them.
Just to dry it, look, the air comes out of this. Can you feel the air? Can you feel that? I'm just going to blow some air like that on one of your teeth, just have a better look. Open it really big for me, please. As big as you can.
It is also essential that you continue to engage both the parent or carer and the child throughout the examination. For the child, it is important to use their name to show a personal interest. Check throughout the examination to ensure the child is not experiencing pain. Praise their good behaviour and be genuine in your approach. Remember, your overall goal is to gain the child's trust. And, with the parent or carer, remember to explain the results of the examination, including radiographs, and discuss the treatment plan, including informed consent, and clarify any misunderstandings they may have.
I'm just going to put these gloves on like this.
We've got these really cool sunnies here, and I need you to pop them on for me, okay? Because we're going to have a bit of a bright light here.
Good.
So we have to be able to see your teeth.
Do you know how many teeth you've got? Do you want to take a guess?
Have a guess.
What?
How many teeth you have?
3.
3? Okay. Well, what we're going to do is count your teeth and tell you how many you've got, okay? So the first thing we're going to do is we're going to put the chair back. Would you mind doing that?
Yeah. Okay, I'm going to press my little magic button here, and the chair's going to go back, okay, but slowly. All right? So you just lay back there and follow the chair.
Now what I'm going to use is this mirror. Can you see the mirror? Have you had this mirror before? Have a look in the mirror. Can you see your eyes in the mirror? Can you see that?
I can see my
Glasses.
but my nose, my mouth, my legs.
You can see them in the mirror?
And some of my cheeks.
Okay.
And where the stars go.
Okay, good. Well, what I'm going to do, I'm going to use this mirror to have a look at your teeth, okay? So open for me, let's have a look. I'm going to use this little scratchy thing, and I'm going to scratch on your teeth like this. I'll show you. Can you feel that? Can you feel me scratching there? Okay. So I'm going to just scratch with that around your teeth, alright? Just to make sure that there's no germs hiding in any of your teeth, alright? So open really big, as big as a tiger. And I'm just going to scratch around. You've got really nice teeth, okay? You're brushing them really well. And Dad obviously is doing a good job of helping you brush those teeth, huh? Good. Fantastic. Well done. Do you know how many teeth you've got? You said you thought you had 3, is that right? Well, you've got 10 on the top, and you've got 10 on the lower jaw as well. Alright, so how many is that, do you think?
10.
10 on the top, 10 on the lower ones, that's 20 teeth. No problems, he's got really nice teeth and his gums are nice and healthy. So obviously you have a good technique of brushing his teeth, that's great. She's got really nice teeth, really beautiful teeth, okay? You keep them nice and clean.
Yeah.
Do you brush them for her?
She does it and then I finish off.
Okay,
yeah.
Good, that's excellent.
Yeah.
So you let Mommy brush your teeth for you? That's very good, that's very good, because your teeth are beautiful and you need to keep them beautiful like that, okay? However, on, I think 3, is it 3 of her teeth on the chart?
Yes.
3 of her baby molars, the back ones,
Okay, yeah.
are starting to show sign of decay.
Oh, really?
Really early decay, okay?
Yeah.
So what we can do, we can put some sealants on those teeth to stop the decay from progressing.
Oh, okay.
But we need to ask the question, why is she getting decay?
As you will be aware, no 2 children are alike. It is important for practitioners to adapt to the needs of each child and employ different techniques when necessary. For example, The lap-to-lap approach often allows for greater ease of examination, whilst allowing the parent to comfort and remain close to the child.
Okay. Now, sit her on your lap, the other way, so that she's facing you, with her legs on each side of your legs.
Yeah. Oh, come here. Give Mummy a
Ready?
look.
That's it. Good. Now, what we need to do, we're in a good position. What we need to do is get you to put your head back here for me.
Let's have a look at these teeth of yours.
She's gonna lay down.
Lay down, Mummy.
Lie
Lay
back,
down on
lie
Mummy.
back.
That's it.
And then it's alright, it's okay, sweetie pie. Just put your head back, that's
It's
it.
all right.
And Mummy can hold your hand.
It's okay. Hey.
These glasses down.
It's all
Could you
right.
pass me the mirror?
Don't be scared. It's okay.
Look at it.
It's just there.
Okay, sweetie pie. Open
It's
big.
okay. Let's have a look at these
Open
teeth.
big. What beautiful teeth you have. Okay, let's have a look.
Good girl. She's getting
Okay,
her
so
teeth.
we've got from D to D on the lower. Alright, we go up a bit.
Notice how the dentist gives the child a break mid-examination as required. He remains calm and positive, continuing to give encouragement and praise throughout the examination.
Look at the mirror. Can you see the mirror?
Okay, come on.
Okay, now we just do the top ones
Let's have
and
a
that's
little
all.
look again.
Open big for me. Open big.
Nearly finished. Good.
Okay, from D to D as well. Okay, close your teeth together. Can you see how her top teeth are much more forward than the bottom ones? Otherwise, her teeth are really nice actually. Okay, sweetie pie, well done. Very good girl.
Do you want to take your glasses off? There we go. Ah, good girl.
There we are.
Really good girl. Hey, do you know how many teeth you've got? You don't know, I'll come back.
Some children will be more comfortable than others within the clinic environment. A valuable skill for the dental professional will be the ability to be flexible. It may be necessary to change tact in the midst of a consultation in order to meet the child's specific needs.
You put your head back,
Wow, like a car.
put your head back and just relax.
Lie down. Lie down. Good boy.
Oh, what a fantastic boy you are. Okay, you just stay there. On for you, okay? And you can then come from behind and clean his teeth that way. Give a bit more time. Now, for him to brush his own teeth, I wouldn't put any toothpaste on it.
Okay.
So how old again did you say?
16 months.
16 months. Well, the current guidelines are saying that we shouldn't put any toothpaste or give him any toothpaste with fluoride in it till he's 17, 18 months.
Oh, really? Okay.
So you can
Well, that might
get
help
away
the
with
situation.
that the
Yeah.
But once you start, if he continues to want to just brush his teeth and won't let you sort of, or you have to sort of struggle with him. You want to sit on
Yeah.
me, do you?
Can you sit on Dr. Henry's lap?
Then it would be best to let him brush without toothpaste. And then when you're brushing, you can put a very small smear of toothpaste on the
Okay.
toothpaste. Actually, it might be easier if we could do it lap to lap, I think.
Yeah.
Yeah.
He wants to sit in the chair, but I think it would be easier
Yeah,
lap to lap. So if
okay.
you put him on your
Yeah.
on your
sit on my
lap and
knee.
sit in your chair.
We can see that the dentist has changed from his initial approach in response to the child's needs.
Can you see the mirror? Could you adjust the light for me, please, Jenny? Open for me, sweetie. Open again. Good. And down the lower ones. Let's have a look. And one more time, and we're done.
In changing from chair-based to lap examination, a successful and positive outcome resulted.
There are different techniques I use to treating very challenging young children. Treating children, it's not always easy. It may take 2, 3 or 4 visits before you can get them on the chair. So I usually be very patient, try to make it very simple, begin the examination or the first couple of visits maybe just lap to lap when the children are sitting on their parents' lap, or even when they're 2 or 3 years old, I still do that, and slowly gain their trust. The child might be crying, don't want to come anywhere near the chair. I use older sibling as a role model. I ask the mother or father to bring another child to the next visit, and I use them. If they're a bit older, if they had the dental treatment previously, they're usually a good role model for the younger children. And I do some work on them, or just even a checkup and a polish or something that encourage the younger sibling to get on the chair and go have a go at it.
You've got to be a little bit creative. Every kid is a bit different, and there are some things that work for one kid that may not work so well for the other. So it's, I think, being a little bit brave and creative and trying new things. Patients that are challenging, we first of all try not to separate mum and kid then. Either we'll have a lap to lap, or we'll get the kid to lie down on mum. There's a lot of show and tell where we actually count mum's teeth. We will get the kid to put a glove on if they like and count mum's teeth. Very often we'll get a sibling then, who will count mum's teeth, or I'll let an older sibling or a more confident sibling, I will count the sibling's teeth and then move on to the kid. A lot of the time we will start at the most, we'll do a checkup and introduce triplex, so Mr. Wind. So when I press the air, it'll be Mr. Wind, but Mr. Wind only blows on the hair first and mum's hair, and mum enjoys Mr. Wind and the sibling usually enjoys Mr. Wind, so then Mr. Wind may not be so scary, and the suction gives little kisses, so that we try it on the hand and on the cheek and on the gradually getting closer to the mouth area. On the lips, they give little kisses on the lips, and then maybe the tongue, and so that's just great, getting things in the patient's mouth. I think the first step with very challenging kids is just letting them getting to the stage where they allow you to get into their personal space. Maybe the next appointment or the same one, I may try a prophy with starting the prophy brush really on their finger, on mum's finger, on their finger, and likening it to everything that's familiar to them. I yet let them hold a lot of things so they have a feel of what it is. I have had, and always rewarding kids, even if all they did was sit still that appointment, I'll sit them up and say, you were very good at sitting still. And say, this sticker is for sitting still. Well, you didn't let me count your teeth very well today, but maybe we'll do it next time and you'll get a sticker for let me count your teeth. So just rewarding what the kid could do at that point in time. Another thing that I found is sometimes lap to lap just works. I've actually done cons lap to lap. We've had a kid who just wouldn't sit in the chair, didn't want to sit in the chair on mum as well. So we actually stayed lap to lap, and I did 3 or 4 fillings on her, and she was fine because mum was playing with her,